I also wanted to thank the many businesses who responded to our call to arms yesterday. It's really important for businesses to keep going during this time. We know many can't because of the circumstances, but many in New South Wales are still going well, and we want to encourage that. And yesterday, when I asked businesses in New South Wales to put up their hand and register with us to see how they could support us in retooling to provide vital medical supplies which we need, we had over 500 businesses register already, and I'm really pleased with that. Thank you to each and every one of you. Our people will now follow up to see what opportunities we have, to see what we can manufacture here in New South Wales, to really ensure that we have the medical equipment we need during the next few weeks and months. I also, again, wanted to thank all of our frontline workers who are supporting the community, in particular the police. Police, as the Commissioner said yesterday, are using their discretion during this time and will continue to do so. But we also ask for everybody to really make sure they respect the restrictions put in place. I also wanted to thank Minister for Planning, Rob Stokes, who joins me today. We want to encourage businesses that are going to keep going, and the Minister for Planning has now announced a new set of rules, a new set of orders, which will allow businesses to be more flexible in when they operate, and I'll allow him to make those announcements. But really, the core of that is to make sure we provide every opportunity for businesses not only to keep going, but to make sure that they're accelerating what they can do during this time, because the businesses that are going are supporting the rest of us as we go through this time. I also want to acknowledge Dr McAnulty, who will provide an update on the cases. Yes, he will update that the acceleration of cases in New South Wales isn't growing, which is a good thing. So we know that we're having some level of success in reducing the spread, but we have to maintain our vigilance. We are at a very critical phase. And the reason why, of course, we've imposed these restrictions, and the reason why we're going through this, is to make sure our health system can cope when there's more people being admitted into our ICU. So we're using this time to really redouble our efforts in increasing capacity in our hospital system to make sure it can cope when more people present. So again, a huge thank you to everybody who's firstly responded to the call to arms, more than 500 businesses who've registered already to support us in providing the supplies. Thank you to everybody for adjusting to the new restrictions, and thank you to our frontline workers who are supporting all of our efforts during this time. I'll now ask Dr McAnulty to give his report, then ask the Commissioner to provide his update, and then Minister Stokes to outline the new announcements in relation to relaxing some of the planning laws.
Thank you, Premier. I'd like to report yesterday until 8 o'clock last night, 116 new cases were reported in New South Wales. That's down a little from the previous day. In total, we've got 2,298 confirmed cases in New South Wales now, and we've tested over 108,000 people who have tested negative. Sadly, we have 10 deaths, including yesterday the death of a 67-year-old woman in Orange. Of the total 2,298 cases, 1,419 have been acquired overseas, 467 were locally acquired from a known confirmed case or cluster, and 307 were locally acquired without a known link to a confirmed case, and 105 are still under investigation. In terms of intensive care, 43 patients are in intensive care as of last night, including 20 who required ventilators at this stage. Thank you very much.
Thanks, Premier. Thanks, Doctor. The police and the emergency continues this morning. The operation in relation to the international flights continues. We have some 3,557 people now in hotel accommodation in different periods of isolation. We're continuing to improve that process. There are 7 families now that have been moved to apartments, just as an example of the evolution of that process. We're trying to make sensible decisions continually in relation to the isolation, such as a man who flew back was a quadriplegic, and we sent him home, obviously, to self-isolate. So we are reviewing individual cases, and we're doing our best to make sensible decisions that won't have an impact on the health of the rest of the people of New South Wales. More people will arrive today than expected. There are now another about 500 people will arrive, And can I say, we've also got people like our returning Defence Force personnel, some 200 soldiers who will return from the Middle East, and the head of Joint Operation, General Bilton, has given an undertaking that they feel like they should come back into isolation like everyone else. So they'll come to Sydney, they'll go into a hotel room, and they'll be treated like the rest of the community, which I think speaks volumes that there are lots of people who want to come on the journey in relation to this. In terms of the new isolation powers, there certainly lots of questions about exercise, and I get it, and we want people to be able to stay fit and physically and psychologically healthy, and we're trying to make sensible decisions in relation to that. But of course, if I said it's okay to sit on a park bench, then everyone's going to go to the park, and we're going to end up back where we started. On a day, hot day at Bondi Beach a couple of weekends ago, one person said they're going to go for a swim, and we ended up with 10,000 people. So this is all not without its challenges, and we're continuing to take a sensible approach. 3 tickets were issued in the previous 24 hours in relation to isolation, and we put that information out to the media, and the explanation will continue to do that. 4 men in a park drinking alcohol, not exercise. 3 of the men left, 1 refused to go. He got a $1,000 ticket. You know, I think it's entirely appropriate. I'm reviewing all of these tickets personally, which would never happen again for any other time. So, and I'll continue to do that. And if I think it's unreasonable, it will be withdrawn immediately, and we'll make personal contact with the individual. But police are out there. We're doing our best to protect the community in a very different way than what we normally do. And I just would ask that the more the community works with us on this, and they understand that we're trying to slow the spread of the virus by minimising unnecessary contact, the safest place at home is at home in isolation. And of course there's lots of carve-outs for people who need to work, and we want you to go to work. So from us, we will continue. There was a good question yesterday, Chris, about when's the turn-off period for these health orders. It is 90 days, and I certainly won't be seeking an extension. And I hopefully, you know, people will have gotten the message by then, and we won't be talking about the powers. We'll be just talking about, you know, what does it look like coming out of this. Thank you.
As the Premier has outlined, one of the planning law is one of the tools that we have to shape our response to this crisis, and I'm pleased to outline the latest extraordinary orders under the Planning Act that are designed to help keep people in work and also help keep our community safe. The first order relates to extended hours in relation to construction sites. We're now allowing construction sites to operate on weekends and public holidays in the same way as they can operate during the work week. This means that builders, the tradies and their employees will be able to work on construction sites 7 days a week during their ordinary hours of operation. This will help keep our workforce safe by extending the hours over which these sites can operate, meaning that social distancing by these workers will be easier to achieve. And it will also help boost productivity in a crucial part of our economy that provides employment either directly or indirectly to about a quarter of our workforce here in New South Wales.